Hi, I'm Dr. Jan Jaffer, and this is GotTeeth, a patient-centric monthly podcast featuring local health experts. So today I'm meeting with Dr. Rena from Chew Chew Pediatric Dentistry. Rena, thanks for being here with us.
Oh, well, thanks for having me today, Jen.
So explain to me a little bit about pediatric dentistry. What is a pediatric dentist?
So a pediatric dentist, we are one of the dental specialists. And so we've attended dental school, and then we've done an additional 2 to 3 years of training after dental school, in which our focus was purely on the dental needs of children. So as pediatric dentists, we like to see children as early as possible. Typically before the age of 1, we recommend doing the first exam. And a lot of parents wonder, how am I going to bring my infant to the dentist? They're not going to sit, they're not going to cooperate for the exam. But as pediatric dentists, we're very comfortable examining infants and very young children, and we like to establish that relationship from a very early age, and then we have kind of a dental home for our children where they will come see us on a regular basis over time. So as dental specialists, as pediatric dentists, we do see not only young kids, but we do have a lot of children referred to us from general dentists. Children, for example, who have very extensive dental needs, many cavities that need to be fixed at once, or children who have some fear or anxiety related to the dentist. We're very comfortable seeing those children as well and trying to create positive experiences for them.
That's great. Yeah, and I know that we obviously, do some referrals and the rest, and it is those challenging times where sometimes, the kids just need something a little extra. That's something that you can provide for them.
Oh yeah, absolutely.
So when we're talking about taking care of kids' teeth, I know, kids are going back to school now. It's an exciting time for parents and a challenging time for parents.
Yeah.
We want to make sure that we take good care of our kids' teeth. Mm-hmm. So tell me some at-home stuff. Maybe we can start with there. Is what's the best way to take care of kids' teeth? What are we doing for our kids? How often are we, simply brushing their teeth?
Yeah.
Is floss important for kids or
Right.
not? Because those teeth are going to fall out. So, how do we take care of them?
Yeah. So our recommendations are twice daily brushing, morning and night. And so the mornings, they can be quite busy, especially now that we're back into our routines. Kids are back at school. It can be a lot for families who are trying to get everyone organized and out the door for the day. So in terms of when to brush in the morning, it really just depends on what works best for you, as long as it's getting done, whether it's before breakfast or after breakfast. And for children who are below the age of about 6 or 7, we do love to see parents helping with that morning brush. But kids who are above the age of about 6 or 7, they can typically take charge of that morning brush and do it a lot more independently. And that gives the parents a bit of a break as well, and just helps make that morning routine more efficient. And then at nighttime is when we definitely want to see parents involved in the brushing, getting in there to ensure that the kids are doing a really good job with that. So again, the younger kids will need a lot more help. The older kids, they generally want to be a bit more independent. They want to start doing more of that brushing on their own, which is great because we want them to develop those skills. But we also want the parents to go in after and kind of just redo the brush to ensure that all the areas have been, effectively cleaned. Flossing, yes, definitely. We'd love to see flossing happening once a day at nighttime before bed. We typically recommend using the little floss sticks rather than the string floss. They're a whole lot easier to get in there. And yeah, baby teeth, they do fall out, but the molars typically don't fall out until ages 10 and 12. So kids are going to have them for a fair amount of time. And most kids will develop cavities between their back teeth, and that can be associated with a lack of flossing. So definitely when the teeth are touching and they're tight together, that's when we want to start incorporating flossing. And it's a good idea. Your dentist, who you will be seeing regularly, will always let you know and kind of point out areas where the teeth are tighter together so that you know at which age you should start to floss.
That's great. So I know one of the biggest challenges parents go through, kids are going back to school, it's snacks, it's lunches, and there's a whole bunch of anxiety around, keeping it interesting for kids, making it fun, but also, keeping it healthy. Yeah. And I think that's one of the concerns that we see is that, the easier snacks to give to kids generally tend to be the less healthy snacks to give to kids, because you can buy them and roll-ups and all the rest, and you can just throw them in lunch, and it makes it easier for the parents, but not necessarily what we want to be feeding our kids.
Right.
So can you go over some nutrition, some stuff that we can help our kids, eating healthier? I know some of the stuff that I've learned from you guys recently about like good dessert and a bad dessert almost, like, and stuff that didn't really realize how it affects kids' teeth.
Yeah, absolutely. That's a great question, John, because diet does really play such a big role in dental health and in the development and prevention of decay. So we really always do review dietary advice with our patients because of how important it is. And definitely, like you said, with the lunches, it can be challenging to kind of make them convenient for the parents to pack, but also desirable for the kids to actually want to eat their lunch. So, snacks that are great would be cheese. And cheese, you can buy them in cheese string forms. They're prepackaged, so those are really easy to just throw into a lunch. And their cheese is really good for the teeth as well. It won't cause cavities. Fruit and veg is really good as well. So, and that's where you can kind of incorporate variety into the lunch as well. I would recommend getting the kids involved with packing the lunch. So for example, say, okay, we're gonna put one vegetable, one fruit in your lunch for tomorrow. You pick the veggie, you pick the fruit. And that way it keeps things, a little bit more interesting. The child feels like they have some involvement in that process. And really any veggie is safe, especially like the crunchier vegetables, the leafy greens. Berries are great. Something like apples is great because they're crunchy. The other thing that's really important is sending a water bottle to school with your child and getting them into the habit from a very early age in which they quench their thirst with water. When they're thirsty, it's going to be water. And I would recommend having, maybe 2 or 3 different colored water bottles. And again, let your child pick which one they want to take. And that just provides some variety and again, keeps them a bit interested.
No, that's really interesting to try to get them involved in making or packing their lunch or choosing stuff so that they feel like they had a bit of the decision and it wasn't just mom and dad telling them.
Yeah, absolutely.
So one of the other interesting, things that I've learned over the last little bit is just about like crackers or like goldfish or like stuff like that. Like I know my kids, they love eating those little goldfish, but I've come to realize that maybe that's not the best snack to give them. So can you explain that a little bit to me as to why crackers may not be the best?
And it, like you said, it is sometimes a surprise when we say crackers aren't the best for teeth because we don't perceive them as being sugary. But the thing with crackers is they're basically just simple carbohydrates, and they're also very sticky because they're a dried form of carbohydrate. So they are going to get stuck in the grooves of the teeth and they're going to stay there for a long time. They're not going to rinse off the teeth quite as easily as, for example, bread or pasta. Bread or pasta is about 9 times less sticky on the teeth than a cracker or a dry cereal, for example. So because it's going to stick on the teeth for a long time, the bacteria in our mouth, essentially they'll treat it as sugar and it'll almost have the same effect as a sticky and sweet snack such as a fruit snack or a fruit roll-up or gummy or what have you. So it would be better instead of a cracker to actually have toast or bread as an alternative.
I was blown away because I'm like, well, a fruit roll-up and a cracker can almost be just as bad for the teeth, which is not what most parents would actually think of.
Yeah, absolutely.
Some of the other things, obviously the kids are out playing on the playgrounds. Dental trauma happens in kids all the time, more in kids than adults. What happens, or what do you recommend? What's the simplest thing? Your kid falls and hits their front teeth. What do we do?
Yeah, I would say just right away, give your dentist office a call. Oftentimes we'll even have parents just send us a photograph of the injury and we can screen that right away. One of our dentists will have a look at the picture and then we kind of know, is this something that we need to see urgently, or is there something maybe you can bring your child in the next day or a few days later. But it is definitely important for all traumas, even if it seems like it's not that significant, even if it seems like it's just a small chip on the tooth, we always recommend having an assessment by the dentist because, we always want to ensure that there was no damage perhaps to the root that we can't necessarily see just by looking at the tooth. And then we also want to ensure that we monitor that tooth and the child over a period of time to ensure that there's no future consequences from that trauma.
Great. And the other thing, kids going back to sports, right? So now we're getting kids back into volleyball, basketball, football, all of those things. What can we do to protect our teeth during sports?
Yeah, so mouth guard, definitely we recommend a well-fitting mouth guard, and you can have that made at your dental office. Mouth guards are, extremely effective at reducing and preventing trauma to both the teeth and the jaws in contact sports. And if your child already has a mouth guard, I'd recommend, at your next dental visit, just bring the mouth guard in with you. Have the dentist try it in, make sure it's still fitting, especially children who are at an age when they're losing teeth and they're growing new teeth in. Sometimes that mouth guard may not fit as well. If it's not comfortable to wear, the child's less likely to wear it. So that's one thing to keep in mind. And then the other thing with sports is sports drinks. So kids can oftentimes consume those quite frequently when they're playing sports just to quench their thirst. But again, those can be quite high in sugar, and liquid sugar is going to coat the teeth. It's going to go in between the teeth. So it's a really bad form of sugar. And so like I said, we love to see kids just drink plain water.
Yeah. I think one of the things that we sometimes don't realize is one sip over an hour of time is actually worse than like having the whole drink at once, rinsing out with some water and then moving on from something like that, right? So we don't want to be, playing a hockey game for the next hour and a half and having just a little bit of a sugary drink for the entire time.
Yeah, absolutely.
So anything else that parents should be thinking about at this time, or does that pretty much get most of the ideas across?
Yeah, I would say that, just ensure that you are mindful of when your child is due back at the dentist for their next checkup and cleaning, because we always love to catch issues earlier rather than later. And now that the school year has started, things can get really busy, and I'm sure lots of activities are starting and things like that, but do take the time to figure out when your next appointment should be and get in on time.
Perfect. Well, thank you so much for your time.
Yeah, thanks very much, Jen.